Good afternoon, everybody, and welcome to the City of Toronto COVID-19 media briefing for Friday, May 22nd, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Well, Brad, thank you, and good afternoon. Over the last month, I've been clear about the financial impact of COVID-19 and the need for the federal and provincial governments to help support Toronto and indeed cities across Ontario and across Canada. Toronto alone is facing a $1.5 billion to $2.8 billion financial pressure this year alone. This is due to a combination of the cost of funding the daily on-the-ground response to the COVID-19 pandemic and the loss of revenues, such as that coming from the massive loss in TTC ridership due to the ongoing restrictions and lockdowns of the majority of businesses, which lockdowns we supported and were necessary. Cities have been clear. We cannot slash services right now, nor can we or should we massively raise taxes to help cover these costs. It would take a 47% hike in property taxes to raise $1.5 billion, the amount that we are presently short due to the pandemic. This is just not practical or fair to the citizens of Toronto who pay those taxes. Unlike the other governments, we also cannot run a deficit, a long-standing and good restriction for municipal governments who don't hold the same revenue tools as the other levels of government. Now, I'm encouraged by the positive comments from the most senior federal and provincial leaders last week, and I understand discussions have been ongoing between those two governments, but we have yet to hear in any city across the country, including Toronto, a financial commitment or even the beginnings of discussions leading to a financial commitment. This jeopardizes the ability of all cities to continue to respond to the COVID-19 emergency and to help form a stable foundation at the same time in those cities across the country, including Toronto, for the local economic restart and recovery. Strong cities built strong economies across this country before the pandemic, and strong cities are going to be needed to rebuild and restart provincial economies and our national economy after this emergency. Toronto is Canada's economic engine. We are ready to rev up, but we cannot stall. That is exactly what is at risk if the federal and provincial governments don't come to the table with funding support for Toronto and for all Canadian municipalities. Without immediate support, our city, like many other cities across Canada, in fact, I think without exception, cities across Canada, is facing unprecedented cuts that will hurt this city and every person and every business that the federal and provincial governments have been trying to help over the last weeks since this pandemic began. City staff are working to find savings. We find millions of dollars in savings every year, and we're hard at work identifying savings right now. But even with prudent, sensible steps to reduce costs that don't reduce services, we would still need support from the other governments. But as the year goes on, we also have to plan for what would happen if we don't get that support, if no support is forthcoming. And that increases the magnitude of the cuts that have to be made to services because you're further along in the year, but the number that we're short doesn't itself go away. City staff have calculated what would have to be cut if the province and the federal government take no action to help us. And I thought it was fair that I should share the magnitude of those kinds of service reductions. I mentioned the tax increase previously. I thought it was fair I should share the magnitude of those service increases with you. I find these cuts completely unacceptable. Unacceptable even to contemplate, but it's the reality of where we sit today. I don't know how we can contemplate cuts to our services, though, when we are at a time when you, the people of the City of Toronto and people in cities across Canada, need those services the most. I believe it is important for everyone, especially Toronto residents and residents of the GTA who rely on Toronto and stable local finances in their own cities, to know how terrible and devastating these cuts would be, like nothing we've ever seen, if the other governments don't decide to step forward and invest in the well-being of our cities. Preliminary City of Toronto cost containment measures to generate savings this year to make up for the $1.5 billion would likely include the following: a $575 million reduction to TTC service, just as we try to maintain service levels to support physical distancing as much as we possibly can. This would basically require a 50% shutdown of the entire TTC service. Now, you may not know what a 50% shutdown of the TTC service would look like. Well, it would look like service on Line 1 and Line 2 of the subway would be cut in half. Line 3 in Scarborough and Line 4 in North York, the Shepherd Line, would be shut down entirely. All streetcar service levels, including King, Queen, and St. Clair, would be cut in half. Streetcars would come only every 10 to 20 minutes. Major bus service levels, including Jane, Dufferin, Steeles, Finch, they would be cut in half. Service would operate every 10 to 20 minutes. There would be a $73.6 million reduction in Wheel-Trans service. That would cut more than 4 million Wheel-Trans rides. Toronto Fire Services, which has seen an increase in fires this year, it would see more than a $23 million reduction. In the case of the Toronto Police Service, they would see a $31.3 million budget cut that would eliminate 500 frontline officers. An unacceptable reduction just after we worked so hard in our budget with the police service to hire those same officers to try and help us to fight gun violence. We would be forced to eliminate almost $40 million in child care subsidies. This would lead to the elimination of 40,625 child care subsidies to families living in the City of Toronto. Just as we have expanded our shelter services, you've heard us talk about that throughout the pandemic in order to help with physical distancing, we would have to cut our shelter budget by $101.5 million. This would lead to a 50% reduction in the shelter spaces added. Our recreational programs would see a $40.8 million reduction. That represents a 50% reduction in recreational services and the closure of 61 community centres and/or the loss of 600,000 hours of recreational programming. Long-term care would see a 50% reduction in spaces in the residences we own in order to save $12 million. And that would lead to the elimination of approximately 1,320 spaces in our long-term care residences. Library branches would have to be closed. The subsidy for Toronto community housing would have to be reduced. And new investments made just this year, just in the 2020 budget, in the last few weeks, only a few weeks ago, in youth hubs and youth spaces set to open in September of this year to help us address the roots of gun violence in our city, those would have to be cancelled. Without support, the city would be forced to consider putting as many as 19,184 employees out of work. That would be 19,184 more people out of work, regardless of who they work for. We can't afford to have those kinds of numbers of people put out of work any more than we have out of work already. It will hurt those individuals and their families, but it will also further devastate the GTA economy. Capital projects would also see a $451 million reduction, including critical capital and transit projects slated for this year. Those capital projects, as you know, they create jobs and they help drive economic prosperity, something we know not just for the sake of this city, but for the sake of the entire country will be absolutely necessary in the coming year. We would be left with a city that can't work, and it would be unable to keep helping the people who rely on that help the most. I have been working non-stop to bring this to the attention of the other governments and to secure their funding commitments, and that work will continue. I said the other day on television, I've had a lot of encouraging words, but encouraging words don't buy childcare, and they don't buy transit service, and they don't buy help for the homeless people. They don't buy anything, quite frankly. If they want to help increase the early confidence that people are beginning to feel about our prospects to wrestle this virus to the ground and to have a healthy, robust recovery across our country where people get back to work and back to enjoying their lives, if they want to help seniors, if they want to help the most vulnerable residents and make sure that the largest transit system in this country, one of the largest in North America, can function properly, if they want a robust economic recovery which can and should and must be rooted in our cities, then we need that help now. We need that help now. While we mount this campaign, the work of restoring services continues. So I am happy to report to you, amidst all of this other unfortunate news that I've had to share with you today, that the Toronto Public Library is working to reopen, with people being able to drop off books that were on loan starting on Monday. And I think you may have heard that this is a daunting task to get reorganized in that regard, and that there are 1 million books out in the system right now, 1 million books that are out of the libraries in the hands of people across the City of Toronto. Safely and carefully reopening our libraries to residents in this phased approach is another step on our journey to recovery and getting residents back to the activities they engaged in prior to the pandemic. It's why it's so important to get financial stability and keep it so that we can carry on with this work of reopening the city and getting people back to work and back to their normal lives. I want to thank library workers for their efforts during this pandemic. It's been fantastic to see what all manner of public servants have done to make sure the city kept functioning and we kept delivering essential services and delivering special services to the most vulnerable. And the library workers have helped in that regard by helping to operate food banks, 11 of which have operated inside some of our library branches. And I want to thank city staff for the work that they're doing now to take those food banks that were temporarily located in libraries and move them to other locations where they can continue to serve people who are in need of food security. I also want to give a shout out, because these are the stories that are good to hear any day, but especially good to hear perhaps on a Friday afternoon after I've shared some unfortunate news with you. There's a library service manager by the name of Young Lark Jin Hu, who with the help of staff working at the Albion Food Bank, mobile security working at the Rexdale Library branch, and the library ITS team, went above and beyond to help one resident of Toronto stay connected. And that's how we help each other, isn't it? One person at a time helping somebody else. Last week, young Lark received a message from his local councillor's office. An elderly library customer had contacted the councillor to say that she couldn't access the Wi-Fi outside of the library branch, because the branch, of course, itself is closed, at the Albion or the Rexdale branches, and those were her only way to access the internet. So young Lark contacted the library ITS department and staff working at the Albion Food Bank and security working at the Rexdale branch, and all of those people confirmed that the Wi-Fi was in fact in good working order. So because young Lark felt that the customer, who was in her 90s, may have had difficulty getting technical help over the phone while troubleshooting her device, he offered to meet her in the library parking lot while maintaining physical distancing to figure out how she could connect to the library's Wi-Fi. When the customer arrived, young Lark talked her through finding the Wi-Fi settings on her iPad, got her connected to the Wi-Fi, and provided the 1-800 tech support number just in case she needed help again. And so the woman was able to access the Wi-Fi from outside the building, and everybody was happy. But it's just one of the thousands of good stories happening across our city every day as city workers, including library workers, go above and beyond to get the job done, whatever job that may be, to help our residents. Those are the very same people that are paid from the $1.5 billion that we're short because of reduced TTC ridership and because of the costs of looking after people during the pandemic. Those are the very same people, just dedicated, determined, compassionate public servants with whom we need help so that they can continue to do what they do. And you know that most of municipal services are provided by people, So thank you, young Lark, and all of your public service colleagues, and we're going to keep fighting to maintain and keep going those public services that we know make Toronto a special place to live. So after 10 weeks, we're at a pivotal moment in the fight against COVID-19 in Toronto, and you're going to hear more about that from Dr. Davila. We have helped to stop the spread of this virus through the measures that have been undertaken and the sacrifices you've made, and we have saved, based on all the projections we heard about back earlier on, countless lives, thousands of lives that might have been lost to this virus. So now we need to finish the job while we move towards more open parks and streets. And the part that you have to play in finishing the job is to exercise personal responsibility this weekend. I know some people were alarmed to see the sheer number of people in our parks last week and over the last few days for that matter. I've seen in the pictures, and I've been out myself last weekend to see that while there were many people in places like Trinity Bellwoods, I know most of them, most but not all, were keeping their distance while still enjoying being able to be outside and be in the parks. This is going to be the big test for all of us. Striking that balance between opening up the restrictions enough for people to be healthy and outside, while still making sure that people avoid gathering together at close quarters with one another and avoid spreading the virus, that is the test. The doctor's advice is simple. Stay home as much as you can, and stay local, and stay focused on keeping yourself and others safe when you do go out. Keep your distance from people unless you live with them. Wash your hands frequently and avoid touching your face. Wear a face covering when you go into a store, ride on public transit, or in any situation outside your home where you can't keep your distance. We are making progress. Things are getting better. I can feel the confidence. I can see it on the sidewalks and in the streets. I can see the confidence starting to come back, albeit gradually. But just like when you're recovering from illness, the most important thing to do is what the doctor says you should do. We're working really hard to help get this right, to help all of us get this right, keeping you safe and healthy, delivering quality services to you on a continuing basis, and helping the most vulnerable people who need that help the most. Thank you for your help. It has been noticeable that people have got on board and have by and large done exactly what they were asked to do. I wish everyone a good weekend, and especially to members of our Muslim community who are celebrating Eid, I wish you Eid Mubarak on Saturday. I wish you a happy Eid, but at the same time, listen to what the doctor says, please. There were some wonderful celebrations I've been privileged to attend in parks and at some of our big buildings where people come out and have a great time celebrating Eid as the rest of us who are not Muslim celebrate other holidays over the course of the year. But it's going to be different this year. It has to be different if we're going to succeed and do what we want to do, which is to wrestle this COVID-19 virus to the ground and get back to a normal life as soon as possible. And on that note, I will ask Dr. Davila to present her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 258 new COVID-19 infections in Toronto. To date, 6,998 people have recovered, an increase of 113 since yesterday. For more detailed data on COVID-19 in our city, I encourage you to visit our website. Each day, my team carefully monitors our local data, and I'm disappointed to report that over the last 3 days, we have seen an increase in our local case numbers. It is important to remember that due to the time that it takes to develop symptoms, get tested, and have those results reported to public health, any data I report to you today can reflect transmission from as long as 2 weeks ago or more. When we see these changes in our data, we look to see why this may have happened so that we can adjust our approach. In this case, our analysis thus far suggests that people may have acquired the virus during recent events where people traditionally spend time with their families, like Mother's Day. We need to keep monitoring our data to see if events like these or increased mixing of people related to reopening is creating more COVID-19 transmission in our city. It's understandable that people want to connect in person with their friends and with their loved ones. I do too. I'm looking forward to the day where I can spend time with my mother and with my friends in person instead of virtually. But we need to be very careful. We need to continue to be careful as we move forward so we don't find ourselves in a position where we have to go back. We all want to continue moving forward, especially now that the nice weather is here. This means continuing to practice physical distancing and not gathering with people outside your immediate household at this time. I know that this is difficult, and I know that you have made personal sacrifices over the past several weeks. But we must stay the course so we can get to a point where we can connect safely in person with our friends and loved ones sooner. As we head into the weekend, as the mayor just said, we are approaching Eid, and for many, this is typically a time of celebration and gathering with family and friends. I know this is going to be difficult, but please do not host or participate in gatherings this weekend. There are many creative ways to stay connected virtually and by phone. Many families have weekly group video calls to help them celebrate milestones, and stay connected during these difficult times. Another way that people have managed to feel connected with their loved ones is by having a physically distanced visit in person from the doorstep. Thank you to everyone who has already made plans to connect with your loved ones virtually as you celebrate this weekend. On another topic, as it relates to numbers, there continues to be confusion about testing targets and confusion amongst the public, which I worry may be deterring people from going to get testing for COVID-19. Firstly, anyone who has one or more symptoms of COVID-19 should get tested at a local assessment center. These symptoms can include headache, sore throat, runny nose that does not fit with your typical seasonal allergies, loss of taste or smell, nausea, vomiting, diarrhea, or abdominal pain. If you or a family member are experiencing one or more of these symptoms, or you have been in close contact with someone who is tested positive for COVID-19 but do not yet have symptoms yourself, I recommend that you should go and get tested. Increasing testing is critical as we move forward to COVID-19 recovery because it gives us a better picture of our local situation. It helps us identify people who test positive for COVID-19 and quickly isolate these individuals and their close contacts. And while it is important to ensure that there are enough tests being performed, it is even better and arguably more important if those tests are being done as part of a testing strategy that helps to inform public health actions. A testing strategy helps us to focus our efforts on settings where we believe the virus is circulating. It also helps us to get ahead of problems so we can reduce the risk of people being exposed to the virus and becoming sick and exposing others, and prevent outbreaks from occurring. At this time, from a public health perspective, we believe that based on how we would typically manage an outbreak, an optimal testing strategy would have three components. First, addressing current risk. This means testing people who have any signs or symptoms of COVID-19, testing in outbreak situations, and testing those who may be at increased risk of complications related to COVID-19. Second, addressing those at higher risk of COVID-19. This refers to testing people who may be at greater risk for acquiring COVID-19, such as close contacts of cases, as well as essential workers, healthcare professionals, and other individuals with greater potential exposure to COVID-19. And third, broader population testing. This refers to casting the testing net wider to understand how a virus is moving through a community. This part of the strategy helps to identify people who might not have sought testing before they start to show symptoms. We hope that in the near future, this will also include blood testing to determine who in our community has already been infected with COVID-19 and may have some immunity. Lastly, on a positive note, earlier today, I am pleased to announce that Toronto Public Health has partnered with the Registered Nurses Association of Ontario to hire local registered nurses to support our case and contact tracing efforts. Through this partnership with the RNAO's COVID-19 Via Nurse program, the Registered Nurses Association of Ontario is actively recruiting registered nurses to join our case and contact management team for the next 3 months. I would like to take this opportunity to sincerely thank the RNAO for their generous support, and I look forward to welcoming our new colleagues to the Toronto Public Health family next week. In closing, the weather forecast certainly looks promising this weekend. I do encourage you to find some time to get outdoors and enjoy some fresh air and some exercise. But I ask that you be wise about where you go so that you are not running into crowds. Please do not socialize in group settings, especially indoors. Please continue to practice physical distancing, and please continue to take care of each other. I'll now turn it over to Chief Pegg for his remarks.
Dr. Davila, thank you and good afternoon. All aspects of EOC operations are continuing, and our teams are doing an extraordinary job of ensuring that critical and essential city services are being provided without interruption. Last evening, our crews responded to what escalated to a 3-alarm fire in a 35-story residential high-rise condo building located at 88 Shepherd Avenue East in North York. This fire occurred as a result of a major electrical system failure in the building's electrical distribution room located underground. I'm pleased to advise that our fire service crews successfully contained the fire before it could spread and that there were no reported injuries. However, the building did suffer a complete loss of electrical power as a result. Our Emergency Operations Center team was engaged overnight alongside our fire, police, paramedic, and TTC colleagues, providing both supports and planning in the event that a large-scale evacuation was required. Fortunately, we were able to allow the residents to remain in their suites, with our teams conducting safety checks throughout the night. I'm pleased to report that earlier this afternoon, power was restored within the building. This is a great reminder that despite our collective focus and attention on the response to and recovery from COVID-19, our essential and critical services continue to operate around the clock and will be there when you need them. I would like to both acknowledge and thank our staff for a job very well done last night and for their collaborative efforts to keep our residents safe. I would like to remind everyone that there will be a number of major road closures this weekend. These closures will be in effect from Saturday, May 23rd at 6 a.m. until Sunday, May 24th at 11 p.m. The major road closures are as follows. The eastbound lanes of Lakeshore Boulevard will be closed from Windermere Avenue to Stadium Road. The eastbound Gardner Expressway off-ramp to Lakeshore Boulevard, which is exit number 146, will also be closed. The eastbound lanes of Lakeshore Boulevard will be closed from Coxwell Avenue to Q Beach Avenue, which is just south of Woodbine Avenue. Bayview Avenue will be closed from Mill Street to Rosedale Valley Road, and River Street will also be closed from Gerrard Street East to Bayview Avenue. Those residents who plan to access these closed roads for cycling or walking should access these areas by bike or as a pedestrian, since nearby parking is limited and no on-site parking is provided. We know that Toronto is home to more than 2.9 million people and more than 230,000 dogs. As the weather gets warmer and more people are active outdoors, here are some important reminders. Dogs must remain on a leash at all times when in public, unless they are in one of the city's 70 designated off-leash areas. Dog off-leash areas located in city parks are enclosed areas where dogs can socialize and run free. These areas are also designed to allow for proper drainage so that we can keep our parks looking their best. Our city parks are shared spaces, and everyone needs to be responsible and respectful of each other. Dog owners are responsible for their dog and for any injuries or damage caused by any dog in their care. Our bylaw enforcement officers are patrolling our parks and will be actively enforcing our bylaws when they encounter off-leash dogs in non-designated areas. The fine for having a dog off leash in a non-designated area is $365 per offense. Finally, we are all saddened to confirm that we learned this week that one of the fox pups at Woodbine Beach was killed. We believe that the fox pup may have been killed by an off-leash dog. The Toronto Wildlife Centre is engaged and an investigation is ongoing. In order to continue to protect the family of foxes living under the boardwalk at Woodbine Beach, city staff have now installed higher fencing. Both municipal law enforcement officers and Toronto police officers are continuing to patrol the area and to educate residents about the need to keep away from the fox family, particularly at dawn and dusk when the foxes are most active. The Ministry of Natural Resources and Forestry is also involved and will make decisions moving forward relating to the safety of the foxes. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for up-to-date information on COVID-19 in Toronto. For more information on active TO initiatives, including a detailed listing of upcoming road closures, we encourage you to visit toronto.ca/active-TO. Thank you.
Thank you, Chief. We'll go to questions. Before that, just a reminder for reporters on the line that city staff are available as well online, including Marianne Bedard from Shelter Support and Housing, Janie Roma from Parks, Forestry and Recreation, and Paul Raftis from Senior Services and Long-Term Care. First question is to Austin Delaney from CTV News. Austin?
Mr. Mayor, Active Toronto seems wildly successful, and as it expands this weekend to the East End, as you know, there was a hiccup last weekend. Is the city ready to make changes in case there's another hiccup like that?
Well, we watch it very carefully. We did last weekend and made an adjustment both in the signal timing and also in the closure of a ramp. I think that that's made us even more careful in doing the review that we had to do of the new closure that will happen to the east this coming weekend. And so I'm optimistic we have it as right as we can. But these things are always, when we do them for events or for other purposes, subject to tweaks and subject to adjustments. And we'll make those tomorrow if we have to, as we did last weekend. But I'm optimistic it's going to be a huge success again. The weather's going to be great. People just loved it last weekend. And it allowed them to go out and have some fresh air in a physically distanced way and to do it in a way they hadn't experienced in Toronto quite that way before. So I'm optimistic.
Any advice, Mr. Mayor, people getting to these locations? Can they drive?
I will tell you that only because I didn't have a bike helmet handy, I made the mistake of driving down to see the lakeshore myself last week, and it was very difficult, as the chief mentioned, to find a place to park. So I would say to people, please take public transit or cycle down there. The way we've put this together is in such a way that it is a road that is frequently traveled, because a lot of people go to the waterfront area to cycle and to walk and to take kids for a walk in strollers. And I would say the best way to get there would be the same way that you're going to enjoy that space, if you can, because driving is just not really that practical, not so much because of the road conditions, but because of the lack of available places to park.
Okay, thank you. We'll go to Haley Cooper now from News Talk 1010. Haley?
Hi there, Mayor Tory. We just wanted to ask about these projected staff cuts of 19,000. Is that on the low end or is that on a high end?
Well, I think it's kind of the average that takes the sort of likely cuts we'd be required to make in somewhere between the 1.5 billion and the 2.8 billion. I mean, I'm operating on the basis that, you know, with the good works of all the people of Toronto and public health and everybody else, we'll get a break or two, and the pandemic aftermath won't last as long. That's where you get to the higher number, is that people just don't go on the transit system for, you know, months at all after we get through the emergency period. So I think the bottom line is, however you cut it, hundreds of people, hundreds of citizens, thousands of citizens affected with childcare cuts, with transit cuts. You can cut it any way you want. You can use any number as the base number. The bottom line is this would be a disaster in terms of a working, humane, livable city, which we've created here, and there's no reason for it. You know, plenty of other groups have got help from the other governments, and I'm very happy about that, and I supported that strongly and still do. But I think that cities, given everything they do to deliver on a lot of the services that people rely on, including the most vulnerable people, are in need of that help now.
And my follow-up, in the discussions that you've been having with the federal and provincial governments, obviously the assistance hasn't been dedicated, but are you getting the feeling that it will be coming down the line, or are these governments saying, I'm sorry, we're tapped out too?
We were told quite properly at the beginning, and I strongly supported this position, that the governments had to move to help individual people first with some of the emergency benefits, and then businesses. And that they understood our problems and understood why they were not problems of our own making, and why they were fundamental to a strong recovery and to the delivery of services to people, especially vulnerable people. And so, we were patient in that regard, as well we should have been. But now, when there are many more groups that have received some attention, and again, I'm not being critical of them or of their need for attention, we are just of the view that the size of this problem, the impact it could have on a strong recovery, and the deserving nature of cities in the context of what they do for the country means that it's time for our problems to be addressed in other than some encouraging words, that we need to talk turkey now and get on with dealing with this problem together as a country and as provinces and as cities, and we're all prepared to play our part. Certainly the cities are, and I think the other two levels of government should be as well.
Okay, thank you. We'll go to Francine Copen from the Toronto Star. Francine?
Oh, hi. My first question is for Dr. Davila. I'm wondering if you can explain to residents the public health rationale behind reopening at a time when the case count isn't really going down. And in fact, I think it's recently come up.
So Francine, you're right. As I mentioned in my remarks, here in the city of Toronto, we have unfortunately seen a rise in the local case count over the last few days. But as has always been the case throughout the entire COVID-19 outbreak, the question was one of trying to apply the appropriate public health measures for the situation so that we're doing the best we can to protect the population, to save lives, preserve healthcare capacity so it's there for those who need it, whether it's for COVID-19 or for other medical conditions, while at the same time ensuring that we can, as much as possible, strike an appropriate balance. We know that maintaining fairly strict public health measures, restricting people from going outside and having very strict lockdown type situations actually has some negative health effects as well. So it's always been a question of trying to strike a balance between ensuring that we have the appropriate protections against COVID-19 and as well giving people the opportunity to do such things as get fresh air, get some exercise, and get some freedom, frankly, for a variety of reasons. Health reasons amongst them, but also social and economic ones. So this has always been the fundamental principle, striking that balance. And when I look at what we have done thus far in the city, the reopenings that we've taken on in the city have largely been with outdoor spaces, and again with minimal risk, but only if people actually stick to the rules and maintain and practice physical distancing. So we're asking our citizens, the people of Toronto, to continue to do that so that we can continue to strike this optimal balance between protecting against COVID-19 and allowing them some freedom, some fresh air, and some ability to get out and about for a variety of reasons, social, economic, and health.
And my second question is, how long will it take to know whether you have struck the right balance or whether we've moved to reopen too quickly? How soon do you expect that to become apparent?
Well, as I mentioned in my remarks, the challenge with COVID-19, of course, is that there is some time lag between when people recognize that they've actually might have gotten symptoms, they go and get testing, and then finally those results get reported to public health. So the way I see things right now, we've done some, there have been certain moves to relax public health measures. I think we need to follow the provincial framework that has suggested that at least you take 2 to 4 weeks and observe, see what kind of impact the changes have in respect of disease transmission, observe what other effects there are, and then cautiously, gradually, and very carefully think about whether it's time to proceed to the next phase or in fact to wait a little bit more to observe the kinds of impacts that we want to see. Again, it's always about creating the right balance. How do we protect against COVID-19 and at the same time strike that balance between reopening and all the other health benefits that derive from that.
Okay, thank you. Next question is to Mark McAllister from City News. Mark?
Mayor Tory, obviously the long list you have provided in terms of cuts is quite the grim one, almost a doomsday scenario. Are we looking at this list very specifically? Is this something that has been put in paper as something that would happen, or is it variable depending on what kind of money you get in certain circumstances? Is it hypothetical, or can people start looking at these things and saying this could actually happen?
Between the contributions we're prepared to make by looking for the savings I talked about and trying to find ways to do things differently and anticipated help from the other two governments, we could be to the point where there were virtually no or no service reductions, and there could be no tax increases beyond those already provided for in our budget. So it is simply a matter of whether the other governments, as well I believe they should be, are prepared to step up and invest in cities like Toronto. In Toronto's case, I can assure them that the economic activity that this will help to preserve and to promote by their investing in helping us out of this problem that was not of our own making will pay itself back to them many times over, both in terms of a robust recovery across the city and help across the country, and also in terms of actual tax revenues that come from people buying more things, working and paying income tax, and businesses that will be paying corporate tax because they're making money. Those are all good things that benefit those governments.
And with regard to getting back to the point on parks, amenities starting to reopen this weekend, you've put your faith in the people of this city to follow the rules. What happens if it gets out of control? Do we start to see more enforcement again? Do police once again get involved? And do we start to see more tickets?
You're trying to get me to be the bad news bearer, and I'll play that role if I have to, because I will tell you right now that I wouldn't hesitate to have a discussion with Dr. Davila if people were not following the rules in large measure this weekend about the fact that on a park by park or on a more generic basis, we have to go back to some kind of state we had before. But what I saw with my own eyes last weekend, because I deliberately went out to the parks because I needed to have a walk, but because I also wanted to see what was going on, I would have said 80–85% compliance. People sitting in groups in the parks having a very nice time. I talked to them, but 15% who weren't. And I didn't want to be the bad news bearer to those people either, so I walked up to them and simply said with a smile on my face, and they said hello to me. I said, I guess you people all live together, because they were sitting like maybe a foot apart each in groups of 8 or 9 people. And I think people get it. I mean, there's been enough talk about all this now that there'd be very few people who hadn't heard the news. So it's only a matter of personal responsibility, and I'm optimistic that we can get that number from 85% to 95%, because there's always going to be 5%. But if it doesn't happen, then we're going to have to reassess what goes on. But I'm optimistic things will turn out well, and that people will be both healthy and happy.
Okay, next we go to Matt Bingley from Global News. Matt?
Hi, Mr. Mayor. I'm just wondering, with all of those potential service cuts, without having any definitive source of or a cash injection, how soon could some of those service cuts begin to come to fruition?
Well, I learned when I was in business, that's the first place I learned it, that the longer you wait into a year when you don't have any assurance that your revenues are going to come back or that you're going to get some help in this case, that you have to start taking action. You can't leave it until September and hope for the best, because by September, if you have to make up the same, say, $1.5 billion, you have to do a lot more in terms of cutting. And so I would just say that the days of reckoning are approaching. And that's why I'm trying to heighten the attention that these other governments, I believe, must pay. And it's not just for reasons of helping us to avoid these cuts. That's important. But it's also for reasons of producing stability here in the economic engine of the country and in other cities across Canada, so that we can play the hugely important role we must play in having an overall robust recovery for Canada. Cities are where 80% of Canadians live, where most of our economic activity takes place. We have to be stable and healthy to contribute to a strong recovery, and we're prepared to do that, but we need help.
And I know you said that a 47% tax increase is unacceptable, but is it, fairly certain that property taxes will go up for residents?
I don't think that should be the case. I think we all know the limitations of property taxes in terms of their generally regressive nature. We brought in a very modest tax increase this year already, and I think that in light of all of the circumstances, it is quite appropriate that the governments that have much greater fiscal capacity than we do, they have the ability to borrow in ways we don't, that they should step up and provide help to the municipality so that people don't have to pay a property tax increase of any magnitude beyond what was already requested of them. And I think that is a perfectly reasonable position. And I don't think they should either have to pay any property tax increase of substance beyond what has been provided for in our budget, nor should they face service cuts at precisely the time those services are needed the most, especially by most vulnerable people. And I think the vast majority of people around the country, because it's all the same taxpayers, I think they would agree with that.
Okay, next question is to Brandon Rowe from City News. Brandon?
Good afternoon. Just to kind of circle back to the foxes. I know that you guys have officers that will be in the area. Volunteers are there as well, but one thing that they are saying is that people don't seem to be getting the message. They're still flocking to the area. They're still taking pictures. They might not be going underneath the fence, but they're going very close to the fences. I'm just wondering, is there anything else that can be done, or what's your message to people, especially as the weather, as you mentioned, the weather is getting better, so more people are going to be heading to that area?
So, Brandon, thanks for that question. As I said in my remarks, our enforcement teams are there and will continue to be there. Their principal responsibility or principal course of action is, as we've done throughout COVID-19, will be education first. We're working really, really hard to continue to educate people and to do our very best to help folks to understand that, as interesting as it is and as nice as it is to see the fox family, the best thing that we can do for those animals is to stay away, and certainly to keep dogs and pets on leash and away as well. So that's the message that will be there. As I said, we are prepared. We are very prepared to take enforcement action against things like off-leash dogs that are not in permissible areas. We absolutely will enforce the bylaws there, and we'll take enforcement action as required. So. That's been happening. I expect it will happen, continue over the weekend, and I actually suspect that will happen with an increasing frequency over the weekend.
Do you have a follow-up, Brandon?
No, that's it. Thank you.
Okay, thank you. Final question then to Derek Dionarain from the CBC. Go ahead, Derek.
Thanks, Brad. This question is for Mayor Tory and Mary Ann as well. So the city moved more people from tents into temporary apartments today. Will there be permanent housing for all of them, and what's the timeline on that?
Well, obviously, one of the challenges that we face in a much broader context, and I'll let Mary Ann address the specifics of those people or of the people generally who have been found accommodations other than in a tent encampment. But obviously one of the challenges we've been talking about throughout the pandemic and well before is the need to dramatically increase the supply of both affordable and supportive housing. And we've been quite prepared to show we'll take some innovative steps like the modular housing project approved at the last council meeting and others to come that will help us address those things faster and more effectively. But I will repeat what I've said before. We will make sure that people are housed in better circumstances than in places that represent a threat to their own safety, to public safety, and to public health, namely tent encampments. Those cannot be allowed to continue. We've gone about it in a humane, orderly way in moving those people to housing and taking those encampments down, and that policy will continue. And perhaps Mary Ann, on that note, would like to address the specifics that you've asked about for today.
Go ahead, Mary Ann. Thank you.
Thank you, Mr. Mayor. Yes, we've been doing a tremendous job working with people that are in encampments. Our Streets to Home staff work very hard to develop strong relationships with people who find themselves in that situation. And since the pandemic started, we have been able to support 157 people move from encampments into safer indoor placements. 125 people will be accommodated in interim housing, and the balance have been moved into either hotel or shelter accommodations. But as I said, these are very strong relationships that are developed with our staff, and part of that is continuing to work with these clients on a permanent housing strategy. So while we're able to bring them inside and help people stabilize, we continue to work with them on their permanent housing plan.
just to follow up here, certainly there's been some progress that's made in getting people into housing. For the hundreds of other people that are still living in tents, what happens to them?
We will continue to engage with people. That is the work that Streets to Homes does 365 days a year. In the last 10 years, we've been able to successfully house more than 6,000 people. So, you know, unfortunately, this is business as usual for us in this case. There are people that find themselves in circumstances where they are living in encampments, and we work very hard to connect with those people and to help them move inside into safe space.
Okay, that concludes today's briefing. Thank you very much for joining us. We'll be back here Monday, May 25th at 3:45 p.m. Please have a safe and physically distant weekend.